last video, my name is Sarah. I'm a nurse practitioner that just recently joined Dr. Mark and Tim here at Whole Family Direct Care. So Dr. Mark kind of stated in the last video that there's a common misconception that you can't have insurance and be a DPC member, or that we're somehow anti-insurance. So we just wanted to kind of elaborate a little bit further on that topic. So as you've heard a couple times probably, we do not bill any insurances. So for our purposes and our services, you do not need to have any insurance. We do encourage you to have some sort of protection in place for services that we can't provide, or accidents that may come up, but I'll kind of get to that later in the video. And you can use your insurance for any orders that we may write for you. So any outside labs, imaging, testing that needs to be done can be billed to your insurance by the facilities doing the testing. If it makes sense for you to do that with your specific insurance plan. However, what we do find is that many of our patients, even that ones that have insurance, find that it makes way more sense to go the cash route, especially once you start seeing that price transparency and the significant difference in pricing there. So essentially, we believe that primary care should be a relationship between a patient and their provider without any middleman. We don't think that you need insurance to receive high quality primary care. Dr. Mark often uses an example of comparing car insurances to health insurances. There aren't too many types of insurance that you pay for that will cover preventative or routine things besides health insurance. So it's only used for catastrophic events, accidents, emergent types of situations. You don't use your car insurance for routine maintenance of your car, right? Oil changes, even bigger issues like transmission or tire rotations. Your car insurance probably tells you where to go to get fixed after you might file a claim for hitting a deer per se. What if they started to tell you where you had to get gas at, or where you had to get your oil changed at, and those options were more expensive and further away and not convenient? It wouldn't make a whole lot of sense, right? So when insurance companies start to dictate what you can and can't do and where you can do it at, you lose so many options and it starts to get very expensive very fast. So we do encourage you to have some sort of protection in place for those accidents, unexpected things that come up, because let's face it, it happens from time to time, right? No matter how much we try to prevent it and anticipate it. A high deductible plan, a health share, can pair really nicely with a DPC membership. Even some health shares will give the DPC members a discount in that coverage. So that's a good option for you to have. So it's just where we strongly believe that primary care should be left to patient and provider with no middleman. The DPC models allows us to cut out that middleman and reestablish the strong relationship between patient and provider. So 4 years ago, when Dr. Mark opened this practice, his mission was to bring back what it means to have your family doctor. This DPC model is doing just that, and we find that patients with or without insurance find it absolutely beneficial and very cost effective to receive good, high quality primary care. Hopefully this cleared that up a little bit and answered some of your questions regarding the insurance coverage. If you have any other questions, please don't hesitate to reach out and ask us, okay? Thank you.